Final topic of the session is on entering the world of Phaco. We have Dr. Merine Paul, senior Phaco surgeon from Thrissur, to guide us in this topic. Welcome, Dr. Merine.
Hello, everyone, and it's lovely to be here. And thank you, Dr. Jyoti, for having me here. So, most of the steps of how to convert and move on to Phaco has already been discussed. So, I will be talking to you about the core problem in Phaco, that is the nucleus management. So, what is essentially Phaco? How is it different from all the other surgeries? Is how you manage the nucleus, right? So there are some prerequisites that you require when you are really going in for a Phaco emulsification, and as a beginner, couple of things you should be careful about. So number one thing is that your chamber should be stable. That will of course depend on how well you have constructed your wound, and you should have mastery over phacodynamics. An intact rhexis, as Dr. Jyoti said, is mandatory, and your nucleus should be mobile. So for that, you need to also be a master of good cortical cleaving hydrodissection. And last but not the least, good hand-eye coordination, which has been covered in the first talk. So let me talk to you a little bit more about the mobile nucleus. So you should be good not only with hydrodissection, hydrodelineation, you should know all the nuances of small aliquot hydro procedures. And once you've done a good hydro, you make sure that your nucleus is exposed. When you talk about nucleus, it is not just everything that you see in front of you. You have to remove the superficial cortex and the epinucleus, and then you expose the nucleus, and then you start managing the nucleus per se. So what are the basic principles? So basically what you're trying to do here is to remove, imagine a cake tin which is filled with cake, and you want to remove it into small segments, and without crumbling the entire thing, you want to remove it without damaging the container. So that's essentially what you're doing in Phaco as well. So what you do is create segments and remove the segments, and what differs is how you create the segments. So we can do it either like in the beginning, we say like always start with divide and conquer, because it is much more safer and much more easier to start off in the beginning. It has two steps basically, which is trenching and cracking. And then you move on to the next step of, the next level, that is top and chop. And then finally, like the so-called, the master's technique is the primary chop. Chopping basically can be either horizontal or vertical. Now let's talk a little bit about trenching. So in conventional divide and conquer, we have two long cruciate trenches, and the problem with that is that while you go down and then you go further in, and as a beginner, you tend to forget that the eye, the lens is like it's a prolate thing, right? So what happens is that when you go down, and then you should actually go up, but because you're starting off, you forget that, and then what happens is that you can get into a punch through PCR. So another problem is that the hardest part of the nucleus is in the center of the nucleus, and once you finish that and you're still going trenching, you're actually entering into the softer part of the nucleus, and that comes off much faster than you would imagine it would. And again, there is a risk of PCR. So these are the things where you need to be a little careful. So a safer modification to this is 4 proximal short trenches, and so the advantage is that you're always on the downslope and you're parallel to the posterior capsule, which I'll show you shortly. And if you're always in the proximal part, it's very difficult to go and engage the PC. So you can, so this is the basic trenching technique, which is like, which I said, with 4 proximal small, trenches. So you don't go beyond, you don't make that long trench. This is best for beginners. Takes more time, definitely. And so you see, you make that trench each time right up to the center, stop there, rotate, go ahead and make the other trench again. So the length of the trench should always be smaller than the rhexis, approximately about 5 millimeters. The depth should be about 2 to 3 Phaco tips. You should be able to just visualize the Phaco, the red glow, and watch for the lens fiber orientation at the floor of the trench. And the width, depending on the hardness of the cataract. If it is soft, please make very narrow trenches, and if it is hard, you can remove more of the nucleus from the center, and this gives you a little more space to work with. Now, second thing is the cracking. Now, when you come to cracking, you have two instruments, the Phaco instrument, and there is a second instrument. You can use your instrument of choice. You can either go in through the main port and use the side port, and the Phaco will actually stabilize your nucleus while the second instrument is doing the separation. And the Phaco also helps you to keep the field of view clear. And this is a easier transition when you are trying to move into a crack and chop technique. So there's another technique where you can actually use two side ports and use two choppers, and you can either use a Sinski or a chopper or a cyclodialysis spatula, whatever works for you. So that's also another technique, but then you won't get the advantage that I just talked about of having the Phaco probe with you. So the cracking technique basically is that, like I said, your trench should be ideal for the hardness of the nucleus. Now, you always position the instrument deep and distal within the trench that you made, and the forces should be parallel to the equator and the bag, and also to the posterior capsule. So your eye should not be bending down. The eye should be looking straight at the microscope. You can make two types of separation, either a straight separation like this or a cross action like this. Now, avoid creating a saucer. This is very, very common when you're dealing with these softer cataracts. So what you do is maintain those ledges. When does it become this saucer? When you are rotating or when you are trying to crack, right? So keep your instruments in the ledge, so that will help prevent. It's not always possible. If the saucer forms, try to move on to a chip and flip. What you do is that you can make small chips and flip the nucleus prolapse it into the anterior chamber, and then aspirate. Now, this is stop and chop. Instead of divide and conquer, you are having 4 quadrants. In stop and chop, you have a proximal downslope, rotate it 180 degrees, and then complete one long trench. And then you crack it into 2 hemi-segments. And once that hemi-segment is made, then instead of trenching further, chop it. So that is it's a transition step to a primary chop technique. Now, coming to chopping principle, you always utilize the natural fault lines, and the Phaco tip should always be embedded in the center of the nucleus. That is not just in the XY axis, but also in the Z axis as well. So the 2 types, the easier one is the horizontal chop, but for that you need a really widely dilated pupil, and the nucleus should be of moderate to hard density. You can use a blunt chopper with the inside cutting edge, and the chopper is passed to the equator and beneath the anterior capsule, and you draw it to the Phaco tip. And then once it is there at the Phaco tip, you horizontally separate. Now, for the final or the so-called the best technique is the vertical chop. Why it is best? Because this is the technique which utilizes the minimum time. So you are in and out very quickly. So in this, what you do is you utilize a sharp tip chopper, which you bring it vertically down. Once you embed it into the the flesh of the nucleus, you embed it, and then you bring the sharp tip chopper vertically down towards the Phaco tip, and then pull laterally just before reaching the tip. And this will crack the nucleus. But very important thing here is that you embed it at the appropriate depth. The Phaco tip is more exposed when you are trying to do a primary chop, and the chop has to be repeated many times. So what are the things you need to be careful when you chop? Please don't chop the bag. So avoid zonular damage. And once you have if you try to chop on the bag, the zonules there will get disturbed. There can be Rexis and of course the most dreaded, the PCR. So coming to segment removal, always remove the smallest piece first. Create and remove one segment at a time, and always keep your Phaco probe at the tip at the safe zone, right? So these are my parameters. You can have yours, but always bring the segments to the center of the capsule and emulsify it as far as possible in the center of the at least at the pupillary plane. Don't come forward or go into the bag as well. So when you come to the last piece, you need to be a little more careful. please lower your parameters, both the vacuum and the AFR, raise the bottle height so that your PC is down, and you can actually, the last piece, come a little more further away from the posterior capsule and come closer to the tunnel, but not obviously at the endothelium. And always use your second instrument as a goalkeeper. Sometimes you have this, which is like you're chopped and everything is chopping, but the central hard part becomes one knob, and this is usually in where the cataract is hard. So you can chop the superficial endonucleus like the petals of a flower and just remove that hard central knob separately, and then proceed with your phaco as you would do normally. So this is basically a kind of pyramid as to how you should proceed with your training. Start with divide and conquer, move on to stop and chop, and then finally the primary chop. But then there may be times when you need to come back down this pyramid as well, depending on the case that you're handling. And there is never, this is the only way I'll do. You always have to keep all the techniques, like Dr. Jyoti said, even at points where you may have to convert. So all the techniques that you can learn them well, and practice and enjoy your entering the world of phaco. Thank you.
Thank you, Merine. Thank you, Merine. That was a real good talk. Now the panel is open for discussion. If you have any doubts.
I would like to ask Dr. Nilufer. You have mentioned a very interesting, all the VR, see, that is the future now of the, the training. But actually what is also available in India is something called as Fidelis from Alcon. That is also now being offered. So both Help Me See and Fidelis, I think, are now available. Do you have any experience with any of this? Has anyone here tried these VR trainings, this thing for cataract? No? I am very happy and proud to say that KSOS was the first society across India to institute VR surgical training for KSOS members. We had this session once at Trishur, and if you get the opportunity, please do go and attend the Help Me See training. It is extremely useful for your cataract surgical trainings. What else? Anything else? Thank you. Okay, any other questions? No. But Jyoti, there was some, you did definitely mention that SICS is a great technique, but phaco is the better this thing. I think in the long term, actually, between phaco and SICS, the differences are really narrowing. And yes, immediately there is a big difference, but between SICS and phaco. But now I think the world is actually, a lot of people are looking at SICS as a primary modality for cataract surgery. And what is your opinion on that?
Thing is that actually, finally, at the end of the day, patient will never ask you which technique did you do, why I didn't get vision. So your primary aim, even if while learning, you shouldn't spoil the eye. You should always have a concern about